Robert, welcome. It's such an immense pleasure to have you with us today.
Thank you. I'm glad to be here.
Robert, before the public knew you as Mary Tyler Moore's husband, who were you? What was life like for you as a young physician finding your way?
Yeah. Thanks, Andrea. I had thought when I was young that I wanted to be a doctor, but it was more about going into the helping professions. My parents were both helping professionals, and so it was about trying to actualize what I had grown up witnessing. What my parents modeled. For me, it turned out to be a little more challenging than I had anticipated it would be. They're both social work professionals, and I thought that, well, they don't get very much respect, so I better be an MD, and therefore I'll command that respect. It took me a while to get into medical school because I was a little bit unusual in my course of study. My study was in human development, family studies, and nutrition, and that at the time was not high on the list of medical school admissions offices considerations. But in getting into medical school, it was very interesting for me because prior to that, I really had skated a little bit in my life. I blessed with a certain level of a natural intelligence that I could get through school and high school and college and without too much effort. But medical school really taught me to learn. And so if you ask the question, what was my life like, before I met Mary, and it really did start with learning how to learn, which was medical school. And we compressed our time in medical school to 3 years in the university that I attended. And then I got thrown out to internship and residency. Again, since I was an unknown entity, did my internship and residency at Mount Sinai Medical Center in New York City. Since they didn't know me, they tossed me to one of the outlying hospitals for my first rotations. Coming in July, of I guess it was 1979. I was put into a university hospital that had the busiest emergency room in the city of New York, and I was left alone for 4 days because it was a July 4th weekend, and had to manage. So I guess I'm trying to create the impression by using that example. Is I think I didn't go home for 7 days. I was so overwhelmed. I was working 100+ hours a week, and I laughed when I got my first pay stub because it said 40 hours a week. So my life was a challenge. It was absolutely consumed, with my training in internal medicine and then ultimately in cardiology. I did not have a great deal of activity outside of my medical training, and so an observation on myself, at the time was both that I was driven by my sense of purpose and desire to do good and to help people. I was particularly concerned about listening to people and to families, which meant that I actually had to spend a lot of time in the hospital that others did not, because rather than avoiding interaction with patients and their families, I was there for them. I felt quite committed to being certain that when I admitted new patients, that I was with them overnight so that I could see them through the most critical parts of their journey, if you will, of their illness, to make sure they stabilized before I left. But all that meant that I was willfully and happily sacrificing myself in my life for my own sake, for my training, but also for the patients and families for whom I cared. And that kind of set the table for me in terms of how I've lived my life since. It really starts with a commitment to purpose, with recognizing the challenges and putting the needs of others first before me, and always thinking about how I can help make their lives better, and being sensitive to the issues that others don't listen for. I think that you do that a little bit in the work that you do. It's an intuition, I guess, in a sense, but it's also, listening with the third ear, is really trying to really see through the superficial and getting underneath, especially when you're dealing with people and families who are facing life challenges, life-threatening illness. There's a lot going on there that if you're a good clinician, you have to listen for. So I guess the shorter answer, to your question is that I was a bit overwhelmed because of the sense of duty and obligation to be the idealized doctor and clinician and be supportive of people as they're going through these very difficult times. I was animated by the level and intensity of the learning at Mount Sinai, which was quite extraordinary. We used to call Mount Sinai, that I was there in the age of the giants, and truly they were giants of internal medicine and cardiology as the fields emerged. And there was so much going on in terms of knowledge doubling. So the shortest answer to your question is there was no time for developing a personal life, if you will, other than the life that I had committed to my purpose.
Thank you so much for sharing. This brings me to the second question that is connected to how you actually met Mary while you were exercising
Yeah.
your duty as a cardiologist and in that intense period. What do you remember vividly about that first moment when you met her?
Yeah. Yeah. Thank you. So again, it just reflects how I was living my life at the time. I was one of a group of fellows, fellows at the Mount Sinai Hospital who joined together to cover other clinicians, more senior clinicians' practices. And for the most part, it was on weekends, for clinicians who were appointed at the Mount Sinai Hospital. But on certain occasions, we would also cover the phones of other internists and internal medicine subspecialists in New York. Um, and on this particular occasion, it was the Jewish High Holy Days in 1982, and I was on call. And I used to chuckle that I was one of the only Jewish doctors taking calls. In any case, Mary had just been in Europe with her mom and dad. Her mom, had some chronic medical problems and had come down with pneumonia when they were in Paris. So Mary called her doctor, and it just so happens that I was covering for him. He was an NYU doc. And so I spoke with Mary a little bit. She explained the situation. I spoke with her mom, and I encouraged her mom to be seen by someone. Now, the rules were that if it was not a Mount Sinai doctor, we were not allowed to see the patients. We would have to direct them to the emergency room of the university at which their attending was appointed. But Mary absolutely refused that path. She said, "No, Dr. Levine, called you. You were the one who, engaged with my mom and persuaded her that she had to be seen. We're going to see you." So I arranged to see Mary's mom at Mount Sinai Emergency Room. She indeed had a respiratory infection. It was treatable with antibiotics. So I gave her meds and sent her home to recover. If you read Mary's book, Mary will have admits at that point that she was fascinated by me at the time. I didn't know that. But a few days later, I went to check on her mom at Mary's apartment in Manhattan because she wanted to go back to LA. So I wanted to clear her for flight. And her mom was fine, and she was able to go home. But as I was leaving, I said what you would imagine a young doctor would say to a patient. It's, "If you have any questions, if you have any concerns or problems, just please call me." And so Mary said, "Is acute loneliness a good enough reason to call?" And I said, and I don't know where this came from because I certainly wasn't glib. I said, "I can't think of a better reason to be awakened at 3 a.m." And so 3 nights later at 3 a.m., Mary actually called me. And she asked me, "Do you cook?" And I lied and said no. And so she said, "Well, I guess we'll have to go to dinner." So that's how we met. It was October 2nd, 1982. We had our first date. We went to dinner at the Cafe des Artistes in Manhattan.
Wow, how beautiful.
Yeah,
And when you think back about your relationship that worked so beautifully, despite the unique differences in lives that you were
yeah,
each leading, what do you believe was the essence of making your relationship so beautiful and so
yeah.
inspiring to others?
Thank you. It's interesting because when I reflect on it, people say, well, she was older than you, and what I say is no, she was just breaking out in her life and was young, and I was just an old man, in a younger person's body. So we were perfectly matched. She used to talk about it. She rolled out of bed in high school and ran out of her father's house and got married. And so she had been always married up until 1980 in her adult life. And so it was only after 1980 that she actually had a single life. And so she was living her best life as a single woman in New York. And I was a young cardiologist. I didn't know a lot about her because in her most prominent years on television, I was, in university and medical school and really wasn't watching television on Saturday nights. So I knew who she was, but I didn't really know the intensity of her stardom. So there wasn't that fanism, to come between us. And she was looking for an independent, normal life. And I was unlike anyone she'd ever met because she was a Hollywood person. And in New York, she was hanging with Hollywood types and business types and others who were, movers and shakers and in a social kind of setting that was very active. And I was very much, to myself and professional and outside of all that. And so I kind of brought some stability, to her life, what she really was looking for. The truth is she wanted to get married again. She wanted the stability of a monogamous, committed relationship with a man upon whom she could lean and could rely. And so we worked because I'm a caring, giving who enjoys the presence of very talented, very capable, very intelligent others. I want to always, would only, be attracted to people who kind of equal in standing. That's to say, I didn't want someone subservient to me. I wanted actually to be challenged by someone else's independence and intellect and creativity and otherwise. So I was not looking for anyone at the time. To be simplistic about it, we just fit. I mean, of course, my caregiver instinct, because of her diabetes, of course, played a role in my wanting to be with someone who I could feel that, purpose and support. So that was a very important part of our relationship, was shared purpose. Of course, you recall that in we were married in 83. In 85, she agreed to be the international chairman of the Juvenile Diabetes Research Foundation. And so at the time when she did that, we're a very small mom and pop organization. So, what I said to her at the time, because it was a risk back then for celebrities like Mary, for people who were in the public, like Mary, to admit that they had medical problems. So I said to her, well, Mary, if you're going to be the face of this organization, then I'm going to have to be the fiduciary. And so that's how we joined the leadership of that organization together. She was the public face of the organization and helped them grow enormously. And I was behind the scenes helping them with their governance, with their research program strategy, with their government relations and other things. And that's why we were very successful, because we were really good partners. And we were partners in life, and we were also partners in purpose. And so I think that's a simple answer to your question. It was a real partnership between us each, and we each respected the fact that we also had independent lives. So that's what made it work. She needed somebody like me. I mean, she was looking to get out of the fast lane. She was looking to have a different life than she had when she was in LA. And I was a good choice for her. And she was a really good choice, for me.
How beautiful. And you've lived through an extraordinary life together for over 30 years.
Yes.
And you've also experienced extraordinary loss when she died 8 years ago. How did loving Mary shape your understanding of joy and love?
I think that when I look at it, from early days, it's a much different answer than from later days. Mary was deeply affected by her diabetes. She suffered many, many, many of the complications of diabetes. And in the end, It stole her vision, and in doing so, actually stole what was her joy. Mary was an icon of independence, and the loss of her vision, of course, stole that independence from her and prevented her from doing the thing that she loved most, which was dancing. But so she also, it wasn't just vision loss. I mean, she also suffered significant cognitive decline, dementia, and the vision loss itself created what were called visual release phenomena, in which she would have the signal from the optic nerve back to the brain would be just random and scattered. And so what the brain would do is it would say, it would give up and say, well, is it this? Is it this? Is it this? And she would be seeing things from her past very vividly. So not hallucinations, but actually visions from her memory due to the disrupted electrical signals from the retina to the brain. And so in the end of her life, she basically lost herself, and so she would come to me every day at around 4 o'clock and beg me to take her home. And so I would put her in the car, I'd drive her around for 40 minutes to an hour, and then drive up to the front door and say, okay, Mary, we're home. And she would have calmed down on the ways. I say all these things, and you and your audience might find this, well, that doesn't sound joyful, but the truth is, joy is all about gratitude. And even though it was really difficult for her and it was difficult for me, watching her lose herself in the way that she did, the joy was in the fact that we were together and could be grateful. I mean, we're obviously privileged, so we're able to do for one another what others can't, and couldn't, for many, many different reasons, including, we had resources, and so joy is in the small things. Joy is in starting every day with a sense of gratitude, having some faith, and just, even if it's simply just telling stories. Oh, nowadays, when I think about, what makes me smile, you know, what do I reflect on? I watch videos of her. I mean, if you look at her as a young woman, as a young comedian, she was magnificent. It was amazing. So what is not joyful about having had a life with someone so brilliantly talented and who contributed so much to the world in terms of helping redefine or helping newly define roles for women. It's gratitude and joy just in having been witness to her life, being present for it, and being a big part of it.
In the documentary Being Mary Tyler Moore, you
Mhm.
helped reveal the woman behind the legend, her
Yeah,
struggles, her strengths, and her humanity. What was your intention with that story, especially because as you were going through the collection of the
yeah,
movies and the pictures, it must have been emotionally super, super challenging for you as well.
yeah. Yeah, it was wrenching. It was surprising. Many of the little video clips that are in the documentary we found at the last minute, in a box in the corner of the basement. But what it forced me to do was to go through all the scrapbooks that she had collected in her life and all of the photo albums that we, from before we were together and then after. And the truth is, it reminded me of a lot of the really wonderful things that we had done together. Again, when we did this, she had passed, and so my kind of bandwidth of view, perspective, was on the last 5 to 8 years of her life, which were really the period of her greatest decline and difficulty. And so looking through all those scrapbooks and the photo albums actually was a positive, for me, because it reminded me of what a wonderful life we had together. And in the videos that you see, especially at her little party that she had with her friends, you know, reminded me, yeah, she actually did love me. And so it was a positive thing, and we wanted to make sure that we told her whole story, because that's the only fair treatment of someone, is to tell their whole story, and trust the audience who loves her to understand.
And what were some of the key lessons that she has taught you about
Yeah,
how to enjoy life and
yeah.
cherish it?
So always say that, Mary was always willing to greet the world with a smile. And not that she was unwilling to fight for what she believed in, and not that but that's how she started every day. I call it her eternal smile. And with that, and then you look at, the grace with which she held herself. I mean, she was a very powerful woman in Hollywood, and yet she always tried to surround herself with the best and the brightest. She would be honest about scripts in a way that, for instance, classic story was with Carl Reiner when she was very young, sitting around at the table reading a script, and she read a line that Carl had written for her. Everyone laughed. It was a great, great joke. And Mary is this young woman says to a giant, Carl Reiner, Carl, I'm not going to say that line. Great joke. Everybody laughed, but it's not true to my character, so I can't say that. And so she was always honest about her work in that way. And she always tried to elevate. She was a dancer, so she understood the importance of the ensemble. You have prima ballerinas, you have primaries, but it's the corps de ballet that's really key to telling the story. And so she understood that, and she understood that in order to elevate, she had to elevate others around her in order to elevate the work. So she would always pass off the best lines, to others. And so she was very collaborative in her work. And so the lessons learned from her are about uh, uh, her grace, her commitment to the ensemble, to collaboration, as being the way to elevate work. And I reproduce that in the work that I do now as a very, very big emphasis on collaboration, and then on resilience. It's, she would just put the flak jacket on, put her head down, and move forward. And she would always say, "What choice do I have? What's the alternative? We must step forward in our lives and continue to move forward and throw off, all the bad things and continue, and meet the challenges with a smile."
Incredibly beautiful. Thank you for sharing. Given that you've spoken about the decades that
Yeah.
you've spent advocating for diabetes research, and how she was really struggling so vividly in the last years because of her loss of vision. How do you keep the involvement in the progress linked to diabetes research alive today?
Yeah. So I've founded and lead what's called the Mary Tyler Moore Vision Initiative. And we're a small medical research foundation, but we've created a global collaborative. We have very substantial anchor academic partners at the University of Michigan, at Harvard, at Medical School in Joslin, a diabetes center. And so with that infrastructure that we've created, with those relationships that we've created, on a global basis, we are having real impact and kind of changing the way in which the field looks at people with diabetes, diabetic retinal disease, which is one of the leading causes of blindness in working age adults, in the world. And how we've positioned it is to say that there's great genius in the world, but they often will sit in a room and say, well, if only I had this and then I could do that. So we're trying to answer the if onlys of the space in terms of where are the barriers to progress, how can we create shareable resources that will help advance the field, that will invite young investigators to dedicate themselves to finding cures for diabetic retinal disease, that will invite pharmaceutical investment in the space. So we've created a roadmap and defined critical resources that we've established that is what has enabled us to bring the global community together. And it's all around three fundamental questions that have to be answered. The first is that you can't solve a problem that you haven't defined. And so it's all about, what do we know about this disease, and how can we better define it so we can create new indications for treatment and for drug development. The second is, you really can't cure a human disease without studying the human condition. So we've stood up a biorepository of human tissue that can be studied, so we understand the disease processes at the cellular and molecular level, and can identify new targets for drugs. And the third piece is, you don't know if you're going to be successful without knowing what to measure. And so we're validating what were called endpoints, things that you can measure in a clinic to tell you that, yeah, this person is getting better or they're getting worse, and create new regulatory pathways so we accelerate the pace of FDA approvals for new drugs. So we're doing a lot of basic science work as well as clinical studies, but we're really doing it in a way that contributes to the entire field so that others can use what we learn and what we put out there for sharing as the basis for their discoveries and progress. So it's the way in which Mary would do it. It's the way in which I defined it for the Juvenile Diabetes Research Foundation way back when, or helped define way, when we first started. You can't do everything. What are the things that you can do that have leverage? That can help advance the field or make the field more attractive to others. I think you probably know it's about $2.5 to $3.5 billion to bring a new drug to market, and that kind of investment follows return on investment. So you have to the philanthropic side and the academic side of the arc of discovery to delivery of benefit to patients has to invest in ways that ultimately de-risk the investment from the commercial side and make their processes more likely to succeed, because it's all about accelerating progress, because at the end of the day, you want to improve patient outcomes. You want to improve, in my case, retinal health and vision outcomes. In order to do that, you need to partner very closely with commercial interests, and you need to figure out what they need to accelerate their processes and to increase their likelihood of success, and then shape some of the academic work in ways that serve the needs of the translation of that into real benefit for patients. So that's a very special role for us, because we're able to bring the voice of the people personally affected by disease to the table. We create urgency. So we have urgency on both sides, right? The urgency of people who are personally affected, we bring those voices to the table. And there's urgency on the side of commercial interests who need to get the answer quickly and get their approvals quickly in order to get a return on that investment. So we try and solve both of those urgencies, ultimately for the benefit of people who are personally affected.
Amazing. And with such an enriching life in medicine, philanthropy, and production, what still surprises you about life? And what new chapter are you most curious about?
Yeah. What surprises me? What surprises me, I think, is that the sun rises every day. Abraham Heschel said we have to face the world with awe. We need to live in a state of radical amazement. And so, yeah, when I look up from my computer and I look around me, and no matter, life is amazing. When you think about all the things we're investing in research and understanding the processes of disease and how to reverse course and so forth. If you step back from it, you have to have a sense of awe about the complexity and miracle of life. So what surprises me is connecting with that amazement, that radical amazement, that awe that I have for life, for resilience, for the ability of humans to do amazing things despite the challenges, including regeneration and self-healing and other things. I think you also asked about the future. Did you?
Yes.
Yeah.
What's a new chapter for you?
Yes. What's the new chapter? Well, I'm trying to appreciate the love of those around me, and come a little bit out of my aloneness. And so that's a big change, for me, since Mary passed. I'm trying to get out more, and it's similar, not just hiding in a corner. The Vision Initiative has helped me a great deal in terms of getting out there, but that's all purpose driven, activity. That's Mary's legacy. That's continuing my life's, commitment to doing good. But that isn't the same as just quiet reflection with people that you love, and so that's really what my next chapter is. Can I step back from my life's purpose enough to have a life for myself?
Beautiful.
Yeah.
And if you could offer our listeners one piece of wisdom from your journey. and something that could potentially change how they live their next decades, what would
Yeah.
it be?
Well, I do think it's this idea of living in radical amazement, in awe, and gratitude, and I think it's again, it's no matter what the circumstance, find those things that are positive in your life, hold on to those things, try and maintain a state of gratitude, and look out to the world with optimism. That's the image of Mary that I use as the icon for the Maritime War Vision Initiative is the image of Mary throwing her hat in the air. That's Mary as optimism. We're going to make it after all, that anything is possible. I think that would be the watchword is be like Mary. You face the world with a smile, be resilient, fight for what you believe in, be graceful, but always have that sense of anything being possible and, committing yourself to your passion, to your purpose.
Very beautiful. Any final words of wisdom, things you may wish to share with our audience, that you think could lift them up, no matter what circumstances they may be going through?
I try and do big things. It's hard to have a sense, of accomplishment sometimes because the goal is big and it's long term, and it's hard to see the day-to-day progress. So I would suggest to people that when they take on big goals, that they think about the small steps that they can take, that they can kind of check some boxes, in accomplishment. There's a beautiful story that the starfish story.
Not sure I do.
So we need to kind of re-energize ourselves on a regular basis and by things that make us feel accomplished. So the starfish story is an elderly man is walking on the beach with his granddaughter, and the waves come in, and there are thousands of starfish that are washed up on the beach. And the little girl runs one to the next, to the next, to the next, to the next, and says, "Grandpa, Grandpa, Grandpa, what can I do? There's so many. I can't save them all." Our grandpa walks up to her and picks one up and says, "Save this one." So there's a phrase in the Talmud that says, "He who saves one life saves the world entire." So I think that's the thing, is we can all have these big visions and our passion and look for doing important things. And I've certainly committed myself to that. But what's that one thing? What's that one life you can save? What's that one thing that you can do that is purposeful, but is a gift to someone else? So let's try and find the thing that you can do every day that's a gift to someone else. There's another construct of that. It's just we talk about being blessed, and I am blessed, but God calls us to be a blessing to others. So find the way in which you can be a blessing to others, and that's where you'll find your joy.
Robert, on these beautiful words, I want to thank you immensely for everything that you have shared. Thank you so much for being such a huge inspiration.
Thanks, Andrea.